Dr. Jim Jameson with Youngstown Orthopaedics here today to talk with you about topics in orthopedic surgery. Today we're going to talk about preventing falls. Falls are the cause of significant orthopedic injuries, primarily in our elderly patients. Patients fall and they end up with fractures, most commonly of the hip, pelvis, wrist fractures, shoulder, spine, ankles, knees, you name it. We've seen it in falls in the elderly. We get these fractures in our elderly patients because of poor bone quality, particularly in women. Patients who are older have a little more problem with balance. They have trouble with their eyesight, weakness in general. Sometimes there's some problems with sensation in your feet, things like that that make you more susceptible to falling. The key is to be safe. You want to be sure you're doing everything you can to prevent yourself from falling. You want to be sure that you don't have throw rugs around your house that you might trip over. Also, extension cords or telephone cords can cause many falls. Having good lighting in your house is very important, particularly at night. If you have to get up to go to the restroom in the middle of the night, you want to be sure you have plenty of night lights around to light your way just enough so that you're safe. You want to be sure that you have railings to use on your stairways. Even put a railing on both sides for extra precaution. Grab bars in the shower are a big issue. I'm surprised at the number of my patients that don't have grab bars when they have their joint replacements or other orthopedic injuries that could have prevented a fall. Also, don't stand on the furniture. Stand on something safe. Use a step ladder that's got a place for you to grab hold of for balance if you need it. If you're unstable on your feet, use a cane. Don't be too proud to be safe. A little bit of prevention is worth a pound of cure as far as fractures go. Be safe and be active. Thanks very much. This is Jim Jameson with Youngstown Orthopaedics.